Hi everyone, welcome to sqadia.com, and now we will continue with our section 4 of the lecture Axial Skeleton. In this section we will talk about the vertebral column, and in this section when we will talk about the vertebral column, we will talk about the functions of the vertebral column, some divisions of the vertebral column, and what are the structure of the vertebrae and how they are present in the vertebral column. So for functions of the vertebral column, we have protection, support, axis, and the movement. Vertebral column provides protection to the spinal cord, and spinal cord is the continuation of the brain. When the brain passes through the foramen magnum of the skull, it becomes the spinal cord. Very, very important structure, again, very sensitive. Injuries to the spinal cord leads to paralysis and different functional abnormalities like bladder and bowel dysfunctions can also occur besides the paralysis. Then the other function of the vertebral column is the support. It provides supports to the different muscles of the body. Axis is your vertebral column is very important for the proper alignment of the body. If the alignment of the vertebral column is not correct, we have different postural abnormalities. Then different movements are performed by the vertebral column, which include flexion. We already talked about this before. Flexion is the bending. So vertebral column also perform the flexion movement. As you can see here, bending. When the person bends, the curve of your vertebral column changes due to the flexibility it has by the cartilage in the intervertebral discs. So flexion. And when we straighten up, this is the extension. Here, straightening, bending, and the straightening. Then we have lateral rotation or lateral flexion when we move to the lateral side. Lateral is away from the midline and medial is towards the midline. So if we talk about the midline, if we move away from that midline, that position is called the lateral. Lateral is away from the midline. And then the other movement that can be done by the vertebral column is your rotation. Rotation to the right, which involves both the lower part of your vertebral column and the hip. Hip joint is also moved in the rotation. Rotation takes place at the hip joint. So these are the movements that take place by the vertebral column. This is a diagram showing how the vertebrae are attached, and this in between we have intervertebral disc, which is the actual cushion between the vertebrae, and these are the cartilages. They are mainly responsible for all these movements and the flexibility given to the vertebral column. And these are the nerves coming out. This is the spinal cord, and the nerves are coming out of the spinal cord on both sides, supplying both sides of the body. Very, very, very sensitive. Any injury can damage these nerves, and depending on the site which is damaged, different complications can occur. Next, division of the vertebral column. Our vertebral column has 5 divisions. portion in the neck, cervical. Cervical is the portion in the neck. We have 7 cervical vertebrae. So these are the 7 cervical vertebrae in the neck. Neck portion is the cervical vertebra. Then we have 12 thoracic, which is in the chest region. Thoracic cage is these thoracic vertebra, 12 thoracic vertebra. Then we have these are lumbar vertebrae. We have 5 lumbar vertebra, and then we have, this is the sacrum. You see, these sacrum vertebra or sacral vertebra, they fuse to make one big bone known as the sacrum. Sacrum here. So sacrum is formed by the fusion of 5 sacral bones or sacral vertebra, and this is the coccyx. 3 coccygeal vertebra, they combine to form the coccyx, known as the tailbone. This is the also known as tailbone. So we have 7 cervical vertebra in the neck region. We have 12 thoracic vertebra, 5 lumbar, lower back. Lumbar is the lower back. Then we have sacrum, 5 sacral vertebra combined to form one big bone known as the sacrum. Similarly, 3 coccygeal vertebra combined to form coccyx, which is the tailbone. Spinal cord, as we talked before, passes through this spinal. There is a hole in the spine vertebra through which the spinal cord passes, and the extension of the spinal cord is from the medulla oblongata of the brain. When it passes through the hole in the skull, it becomes the spinal cord, and it goes all the way from the brain to the second lumbar vertebra. It ends at the second lumbar vertebra. So usually the procedure which is known as the lumbar puncture. Lumbar puncture is the procedure in which they remove the cerebrospinal fluid, CSF, that flows in the meninges of the brain and spinal cord, which are the coverings of the brain and spinal cord. So it's the procedure done to remove that fluid. They perform it at level L3 and L4. What's the purpose? To avoid damage to the spinal cord, because spinal cord is ending at level number 2. If we perform it there, it can damage the spinal cord. So lumbar puncture is done at level L3, L4 to take out the cerebrospinal fluid, which is then tested for different abnormalities. CSF, cerebrospinal fluid. Next, briefly about the structure of the vertebra. The vertebra has, if you see this hole through which the spinal cord is passing. So each vertebra, they overlap each other. So there is alignment of these vertebral, this canal. It's called the spinal canal. Spinal canal, because spinal cord is passing through this canal. We have this spinous process. Spinous process, if you feel your spinal cord on the back, you feel these spinous processes, the pointed tip. These are the spinous process on the posterior. Then we have the transverse process on the side. We have the body of the vertebra. Then we have this facet. Facet is for the joint. It combined with the other vertebra through these. So we spinous processes. We have the spinal canal through which spinal cord passes. We have the vertebral body, facet. And when you see they combine together, body of one vertebra overlapping the body of the other vertebra, and in between we have this intervertebral discs. In between vertebra disc, and in this intervertebral disc we have the cartilages that provide cushion to these vertebra, and they provide flexibility and mobility to the vertebral column. So these are some common structures of the vertebra that combine together to form the vertebral column, which has 5 divisions: cervical, thoracic, lumbar, sacral, and the coccygeal or coccyx tail. So in this section, which was our 4th section, we covered the functions of the vertebral column, division of the vertebral column, and the structure of the vertebral column, and we talked about the spinal cord, where it starts and where it ends. Thank you for watching sqadia.com.